Hello and welcome to Thoughts on Therapy. I'm Bryan Stevens, a licensed professional counselor with a practice in Marietta, Georgia, and founder of TalkForward, who is bringing us this podcast today. I've been active in behavioral health for over 30 years, and in that time I've met all sorts of knowledgeable people. Thoughts on Therapy is the show to bring their knowledge to the general public. I am so pleased today to have William Carroll with me. He is a licensed professional counselor in the state of Georgia. He is a PhD from Liberty University in counselor education. He earned his master's in professional counseling from Liberty in 2012. He has been in private practice in Marietta, Georgia since that time. He enjoys outdoor activities, including running, hiking, and biking. Originally from South Georgia, Dr. Carroll made his home in Cartersville, Georgia in 2008 with his wife, Shannon, and their 3 children. Dr. Carroll's area of expertise is the treatment of autism spectrum disorder, using varied techniques, including innovative approaches such as his Lego therapy. His PhD dissertation is on the unique qualities associated with women who have autism spectrum disorder as seen from the perspective of their adult sisters. I also personally have had the pleasure to serve with Will on the board of directors for the Licensed Professional Counselors Association of Georgia, which is our state professional organization, where he has served on the board as the ethics co-chair. So thank you for being on with us today.
Well, thank you for having me. I'm excited to talk about autism, especially autism here in Georgia.
Yes, well, I'm definitely excited to hear about it. So the one thing I'd like to kind of dig into for our audience to start with is autism has really kind of broken into the consciousness of the culture. And people talk about, you hear, oh, on the spectrum, or I'm on the spectrum, or I think they're on the spectrum. I wondered if you might just open with a little bit, tell us a little bit about autism and how we diagnose it today. What does it really mean to say somebody's on the spectrum?
Yeah, that's a really good question because we hear those words thrown around a lot, whether it's spectrum, neurodivergent. We even hear autism and autistic thrown around. We remember the term Asperger's and hearing people refer to themselves as Aspies. But autism, as we define it today, obviously comes to us from our diagnostic manual, the DSM-5, and it really has 2 major symptom clusters. Restricted and repetitive patterns of behaviors or interest, and then impairment in social communication. So when we hear somebody say, I think I'm autistic or my child is autistic, as a therapist, one of the first questions that should come into our mind is, which one of these 2 symptoms as defined by DSM-5 are you referring to? Are you referring to both of them? And when we think of the spectrum, think spectrum left or right, how far down that spectrum do we go?
Mhm.
Using modern testing, we've divided autism into basically 4s. Think level 1, level 2, level 3, level 4, where level 1 is really not very impaired in most areas, all the way to level 4, where there's a cognitive impairment and also a need for support, think throughout their lifetime, from childhood into adulthood.
Yeah.
So the spectrum includes the symptom severity range from 1 to 4. Referring to our 2 initial diagnoses. It's interesting to note that we think of autism as a developmental disorder today, but it has been around for well over 100 years. Matter of fact, the word Asperger's comes from the man Asperger, who first defined this for us more than 100 years ago. Now, what he observed and reported, of course, is not what we use today. That's not exactly what we use today. But we still see those characteristic traits where there is that delay in social communication. Think of a child to a child as a student to a teacher, or as to a parent, and of course with peers also. And then the classic example of the restricted or repetitive patterns of behavior or interest is, the little kid who lines things up, not to play with them, but to line them up. So don't think OCD.
Okay. All right. Thank you. All right. That makes some good sense. Well, so let's dig into it. I know one of the things I think if we say, oh, I think somebody's autistic, is most people are going to think of a male.
Right.
And say, oh, male autism. Of course, we know developmental disorders are more common in males than females.
Correct.
So do we see a different expression of autism in females than males, kind of right from the get-go?
Oh, yes. And that's a great point because many of us remember the movie Rain Man and with Dustin Hoffman. And that's kind of our image of autism. At least it was in the 20th century. We saw a man who maybe he was institutionalized like Raymond was in the movie Rain Man,
Hmm.
um, disconnected from his family. But the truth is, that's not really how it always presents. The statistic still stands that the ratio of male to female is 4.3 to 1. So for every 4.3 males with autism, there's one female. My research did not exactly validate that. There is, of course, a good portion of females who are misdiagnosed.
Hmm.
They're ascribed some other diagnosis besides autism, simply because there is an assumption based on their communication skills, or there's an assumption based on the fact that they don't line things up on the back of their bed, that they're not autistic, that there's something else going on. And that may be valid, but autism is often missed in women simply because it does not present as it does in men.
Okay. Much like heart attacks, unfortunately.
That's true.
So public service announcement, women, if you think you're having a heart attack, when you go to the emergency room, tell them, I think I'm having a heart attack. I'll describe symptoms because women can be asymptomatic. Okay, that's my
Right.
my PSA for
Yes.
the day.
Yes.
So, well, let's talk a little bit about that presentation then. So how,
Yes.
like if we look at adult women, maybe then I
Hmm.
wasn't diagnosed with autism disorder as a child, right? But now
Hmm.
we're an
Hmm.
adult. What, somebody says, I don't know, I think I might be there. What are some of the presentations that you see in adult women that might be different, or the things that you would look at?
Right. Right. Let's start with that bigger, broader category of restricted and repetitive patterns of behaviors and interests. A lot of times with females, almost all of the time, those are not odd or bizarre. In previous iterations of our diagnostic manual, those patterns of behaviors had to be not necessarily social or productive. When we think of diagnosing any mental disorder, the primary criteria for diagnosing it is that it interferes with daily functioning. It's not really a problem until it is a problem. And so, for a young woman who has a restricted or repetitive pattern of behavior that doesn't interfere with daily functioning, she often gets overlooked for that diagnosis of autism. However, with women, their restricted or repetitive pattern of behavior is often very functional or appropriate, like certain types of clothing. No one thinks of a young woman who has 10 or 12 or 15 outfits as being odd or out of place. But similarly, matching outfits or pairing outfits with shoes, with hairdressing stuff like that is not thought of out of place either. But that is very possibly a symptom of autism as we see it become, again, restricted. In other words, only this color, only this style, only this shoe, multiple copies of this shoe, or repetitive. She's buying and wearing the same thing day in and day out, day in and day out. And I would like to give you this anecdote from my own practice. I saw a young woman some years ago, um, college age, late high school age, wore the exact same outfit every session, I thought. And so as I questioned her and her mother, the truth came out that that was, in fact, the only outfits she owned, with an S, outfits. She owned many, many copies of those same boots, those same pants, that same shirt, that same ribbon in her hair. That is what we mean when we think restricted and repetitive, but it's not bizarre. Matter of fact, most people would not consider that in any way impairing, except that her parents have to go online and find those shoes
Right.
each time her foot grew or each time she wore out that pair of shoes.
Well, so
And it would,
that level of distress with having the
yes.
repetitive pattern broken,
Mm-hmm.
people would say, "Oh, wait, there's something
Yes.
odd there."
Yeah.
So
Yes.
it's the pattern, and I have to have this pattern, and if my pattern breaks,
Right. Right. It's wrong. It's wrong. It's not OCD where it feels wrong. It's autistic in that, no, this is not right. This is not how it's
right.
supposed to be. When we think of OCD or OCPD, we think of the person who lines the books up on the shelf by color or by height. For the autistic person, that's their book and they put it in that place and that's its place. And it's not about a pattern so much as it is a possession. And
Right.
both male and female, it's truly an interesting thing when we think about the neurodivergent population, because for them it is functional, even though for us, our books on our shelf lined up by Roy G. Biv makes no difference whatsoever.
Right.
So
Right.
that's the first one. When we think about young women and we think about that impairment in social communication, this is where we get into the concept of camouflaging, because young women with autism don't normally have as severe a level of impairment in social communication. Now, the mistake when it comes to autism is to believe that they have a communication disorder. And of course, that's not what the diagnostic criteria says. It says there's an impairment in social communication. In other words, me using what I know, interacting with you or the man at the grocery store or the woman at school.
Right.
Girls using their camouflaging skills don't present as having that. Now, there's a couple of reasons for that. One, there's a social stereotype that girls are prim and proper and they sit there and they don't speak up. So to see that in a young woman with autism, it does not look that different. It again, when it interferes with daily functioning, we're thinking she's not asking the teacher for help when she obviously needs it. We're thinking she's not speaking up for herself in the youth group whenever the youth group have an outing. When it interferes with daily functioning is when it becomes a concern. So, and we can talk more about camouflaging, also a very interesting concept with many disorders, but autism primarily.
Okay. Well, I would think too, as puberty hits, especially as the testosterone levels in the boys just go up. Everything that we have seen, that I've seen over the years, and the difference between boys and girls is boys tend to act out sooner.
Yes.
And
yes.
when I've worked with inpatient settings, the girls that had made it to an inpatient setting, like the teenage female adolescents that made it to an inpatient setting, generally, on average, had more pathology. They were sicker than their average male counterpart, because they hadn't been picked up in the system until they'd acted out enough. You don't end up in a residential system as an adolescent unless you've disrupted enough other people, generally speaking.
Yes.
So that outward kind of facing, I'm going to kind of exert dominance over the world, I think that's stereotypically male.
Right.
Probably causes them to show up more. And if my goal is to camouflage, is to fit in, I want to work within the social group.
Sure.
How can I hide some of this weirdness?
That's right. How can I not talk about Doctor Who in front of the other girls who have never mentioned Doctor Who? Well, I just don't share that part of myself with them. And I saw that with a lot of young adult women that I interviewed. They would be very interested in things that we think of as young teen boy entertainment. So, cartoons from Asia, or space sci-fi adventures from the UK or Europe. They simply do not share that with their friends. And as sad as that sounds, and it is, it's the hallmark of camouflaging. I don't share. I don't tell you anything. So I'm wearing this mask, as it were, and you only get to see, frankly, what you want to see.
What you want to see.
That I'm dressing, sex appropriately, and I'm quiet and polite. And every teacher says, no, she's the perfect student. And the truth is, she's, again, hiding that, like you were describing in residential. She's keeping that down until she can't any longer.
Okay. All right. Well, so I think that can really lead into understanding why you talk about there's this misdiagnosis or this delay of diagnosis then. And maybe she's depressed. We like to diagnose women with depression. Oh, she's got social anxiety. Let's give her an nice anxiety disorder. So I think that makes a lot of sense. Why probably, I guess you're seeing in your practice, it's like, well, if I had seen you when you were 10, I'd have been leaning towards autism, but I'm seeing you're 25, so let's get started on this.
And
Okay.
it's interesting. We as human beings, we go to church and we act a certain way. We go to work and we act a certain way. And
Right.
maybe they're very close, but they're not exact. We go into public and we act a certain way. And the deviation in each of those social settings is minute. But for the young woman who's autistic, it's huge. She's at home and she's her true self. And maybe there are outbursts, or maybe there is, again, more of that restricted and repetitive pattern of behavior. But then she goes into public, and again, she puts on her camouflage, right? And everybody sees
Right.
what she wants them to see, and
Mm.
that does lead to the debate: is it a missed diagnosis, like we didn't even catch it at all, or is it misdiagnosis, like we've labeled her with a personality disorder when in fact she's neurodivergent? And that's always a concern with any disorder in any treatment, because frankly, that diagnosis informs treatment.
Right.
And if we have a misdiagnosis of anxiety or depression, or no diagnosis, missed altogether, they're not receiving treatment that they sorely need. And maybe it is something that they catch some of it in depression, they catch some of it in anxiety treatment, because those are very common treatments. But again, the appropriate diagnosis leads to appropriate treatment,
Appropriate
and that
treatment.
is always our goal. We want the highest quality of treatment for, frankly, our children whom we love. And
Yes.
so, yeah, a misdiagnosis of depression, anxiety, personality disorders, even bipolar, um, do not help these young women and young men with autism too. For him to be labeled as ADHD or oppositional defiant or intermittent explosive disorder, when in fact it's autism, the treatments we give for those, pharmacological as well as therapeutic, um, they're
Yeah.
not going to
Or
help
or
autism
OCD.
or OCD.
Yeah.
Absolutely,
Yeah. It's
absolutely.
you was talking about this. One of the things that, coming from a Jungian perspective,
Mhm.
and Jung talks about our persona and our self and our anima or animus and our shadow as kind of the four archetypes in people.
Right.
And I've really come to the idea that the further our persona, or that what we project to the world,
Mhm.
is away from our true self,
Mm-hmm.
the more
Mm-hmm.
energy it takes to maintain that persona for a period of time.
Right.
Right. And when they're close, when those things are right next to each other, is when I finally get to get off stage
Mm-hmm. Mm-hmm. Mm-hmm.
and be myself. So I can imagine that you would expect, if I'm doing this all the time,
Mm-hmm.
there might well be a co-occurring disorder of
Yes.
anxiety or depression. Well, I have any energy because I'm spending all my time trying to bridge this gap, and I don't
Yes.
get to be me.
Right. Right.
And
Or
like
worse, or yeah, or worse yet, I've played this role for so long that stress has built up, and now I'm just going to explode, which means I run away, or I yell at my loved ones, or I lash out against myself. I do some
right,
self-harming, some kind of thing, because I've played this game so long that I have no reserve. No, there's nothing here to help me wind back into myself. You say that, and it reminds me of another antidote, a story I heard during research phase of my dissertation. A young woman, her gift, she was autistic, but her gift was languages. But her parents wanted her to do music. So she became a pianist. Piano recitals were exactly that. Like, she put on the mask, right? She put on her camouflage. She went on stage. She played her music well, got back out to the car, and then erupted as like a volcano, because she had for so long sat there. She had done her part, everybody else had done their part for hours. She had committed to this task that her parents wanted her to do, which there's nothing wrong with learning the piano or teaching our children piano. But for her, that mask, so to speak, she had worn it so long that she just couldn't take it. And getting to the car was her only safe place. And she got to the
mm-hmm.
car and she would break down, whether that was crying or screaming or whatever. And it was that stress. And we, not as professionals, but we as Americans, underestimate how dangerous stress is. Stress poorly managed.
Mm-hmm.
We don't give it its proper vent in its proper place at its proper time. Instead, we put on the show at work and in the neighborhood and in the community, and it just builds and builds and builds. And we get home, and then we become some type of anxious recluse that's like, I just need a day off. I just need another day off. I just need 2 days off. instead of managing stress well, which is one of the techniques we do with young folks with ASD. We
Okay.
work really hard to give them strategies for managing stress, whether that is going back to their loved thing, video games or stuffed animals or Hot Wheel cars, and taking that and having those moments of release, which is a beautiful thing. We may do it a little bit better because we're neurotypical, but yeah, giving that to our neurodivergent clients is
Yeah.
huge and a great way to start treatment for ASD.
Okay. Okay. I like that. Well, so yeah, talking about treatment. So we're trying to give it. I mean, it sounds like right then and there, we're gonna teach you different ways to manage your stress.
Oh yes.
It also sounds like though part of the treatment, I guess a good segue to talk about treatment. Sounds like there's some permission giving to me or validation about who the person
Right.
actually is. I know from my experience in therapy, there are times when I feel like, and the person might be, 50 or 60,
Right.
and we're working together, and this is the first time anybody else has ever said basically, well, I think you're okay as who you are.
Right. Right. Oh yeah. I had this experience recently in doing some couples counseling, where I talked to them, asked, what do you guys do for dates for a long time apart from the kids? And they have really young kids. And so they really paused and sat there in silence for a minute. And then they started talking about what they used to do. And then I realized in that moment that they, as parents, had given their marriage to their children.
Right.
And now they don't have a marriage, they have children. And so I took them back. I said, as soon as this session's over at noon, you leave my office and you go down the road south of here. What if you had an hour, what would you do? Would you stop at the restaurant? Would you stop at the Target store? Would you stop at what would you do? And I literally, in those few phrases, gave them the freedom to think about their independence, what it means to be a couple, a married couple with control of their life, to not have to rush back to be there for the kids because the kids need me. The same is true with a lot of treatments. Anxiety is a great example of this. But for the young adult with autism, that is revelatory because they've always been taken care of, especially if they got that label earlier in life, that diagnosis, and then that definition of your Asperger's. If they got it early, then they feel like that's who I am personality wise. And of course, you and I as a therapist realize it doesn't have to be.
Right.
That does not have to be who you are. Now, just like my height, I'm 5'8". I'll always be 5'8" until I get really old and become 5'7". That is who I am. But nobody looks at me and goes, "You're a 5'8er." Nobody does that.
Right.
But we do that with young people with autism.
You're autistic. Well, and I'm not, so I have my daughter's got ADHD. I've been diagnosed with a learning disability. My son's got a learning disability. I am convinced that these are not disorders for a lot of these cases. Now, I think we can look at somebody like Dustin Hoffman's portraying the Rain Man.
Right.
Just this level 4, there's something has gone significantly wrong for that person. But I'm not 100% sure I buy that for what we would call level 1, or we a learning disability and have ADHD. I think they have brains that work differently.
Right.
In a society that hyper values executive functioning.
It does. It really does.
And it hyper values sitting down and paying attention. And it hyper values emotional control.
Right. Yes. Yeah.
And if we think about other cultural ways of being, this, which I kind of like the idea of neurodivergent, but it's basically, I approach things a little bit differently.
Right.
I think I see
one of my favorite
differently.
Yes. One of my favorite TV shows is Star Trek. And I didn't really like the old Star Trek with Spock, but Spock is a great example because in the 1960s, when he was portrayed on television, he was portrayed that way because the producers wanted him to be seen as alien. But today he's become very popular because he represents a type of autism identity, right? It's like, oh, this is a great example of, and then they name Sheldon, or this is a great example, and they name Spock. And of course, you and I kind of chuckle because we remember Dr. Spock and his child development stuff. But the alien Spock was supposed to be alien, and here we are 55 years later, and we're seeing that kind of presentation of logic and this flat presentation, this flat affect, and we're like, oh, well, that's a certain personality type. And I agree with you. When we think about level 1 autism, these people have very few problems in daily living. Their problems are usually larger over years or over decades,
right?
Where maybe they can't live on their own forever, but they can live on their own for a while. And it's interesting that we do this spectrum thing because we've now done it with schizophrenia, right? So we've done it with autism, we've done it with schizophrenia. I've even heard it described with depression and anxiety. The spectrum thing, where all of us are level 1 for several of these labels, right? Everybody that feels depressed at some time.
Mm-hmm.
Everybody feels anxious at some times. I have teenagers and 2 of them drive. I feel anxious,
a lot of the time. I'm with you there. Yeah, mine are 20 and 18 now, and it's like, oh, they're out. Okay, well,
there it, yes,
yeah. So,
yeah, but is that diagnosable? No, that shouldn't be diagnosable. But then we see the neurodivergent, the neurological part of it. Perhaps low IQ is a better example, because IQ is measured on a scale, right? We think of 100 being average, and we think of less than 80 and more than 120 being their own distinct categories. And how disabled is that person whose IQ is 99 over 100, or even 90 over 100? Is it really interfering with daily functioning? Should we really label them, give them a label that they don't have a choice about? They can't say, no, I'm not that anymore. I'm giving up that. And so there is a big ethical dilemma when it comes to diagnosing, which I appreciate. As a diagnostician, I appreciate that robust debate about should we even give this label?
Of course, I believe the reality is that in the future, what neuroscience will tell us is that, like today, what we call bipolar disorder. Well, there's actually multiple things that end up expressing, or there's multiple things that end up expressing as schizophrenia. Or there's so for the audience, what I want the audience to understand about diagnosing, we really don't have diagnosis in the way that you're diagnosing cancer or strep throat or any of those things. What we're actually diagnosing are syndromes. And what a syndrome is, it's a cluster of symptoms, and we go to our diagnostic manual and say, check, you meet these symptoms. Oh, therefore, you can diagnose this.
Yes.
And so it's a shorthand that can help guide us towards how we need to treat somebody.
Correct. Yes, the big point. Yes.
But it's not, I've done this culture and you have strep throat.
That's right. That's right. Yeah. There's no foreign body inside of our bodies that we pull out and go, oh, this is streptococcal pneumonia. This is what you have in the back of your throat.
They did a scan on my knee here recently and said, well, the reason your knee hurts sometimes is you have arthritis, and we can see it on the x-ray.
Yes.
Yeah.
Yes.
It is mental health diagnoses, tragically, are much more like something like fibromyalgia. So it's a syndrome. Well, and
we respect that as practitioners, because we understand the person coming to us literally has this burden on them that we would call depression, this burden on them we would call anxiety, these problems in living. They literally have that emotion on them. And so we're fully aware of their emotional world. What we would call their soul is burdened. When we think of a Thomas Aquinas and the Dark Night of the Soul, when we think of depression, or Hemingway down in Key West, when we think about depression, because those led to suicide, obviously. That's a big deal. But still, the base point is the reason we're looking for these symptoms to cluster into a disorder is so that we know how to treat it, how to treat it best, to not hand you a stimulant when you need talk therapy and a shoulder to cry on. or more social supports,
or to
which I'm
be
a huge fan of social
yeah,
supports.
be witnessed.
Yes, to
A
be
lot of
heard.
times what we do
Absolutely.
is be heard. So what?
Yes.
What's some other treatments? I mean, like between children and adults.
Oh,
Of course,
yes.
I'm sorry, as an adult, I would be all down for Lego therapy. So sign me up.
That's right. That's
I like
right.
my Legos. I've had play
Oh
therapists
my
say
gosh.
their adults are like, oh, well, use phone to play in the sandbox. So,
That's
but what
right.
are some
That's right.
differences between how you might treat adults and children?
Right. Yeah. Um, it's interesting because how we diagnose autism, we think about the ADOS or ADIR. These are huge instruments with lots and lots of questions, lots of moving parts. But when we take out the ADOS and we bring the kid into the office and we actually pull out of that, it's a big tub. We actually pull out of that tub plastic toys, right? We pull out
Hmm.
these blocks. And what we're looking for is how they interact with them. Will he share it with me? Will he line it up with me? What patterns, if there is any patterns? And so that informs treatment. How we diagnose informs how we treat. And so we look at that and go, okay, if I can teach, and this is a great technique, if I can teach him to interact socially appropriately, then I have achieved something great. And I'm thinking very young children, 3, 4, 5.
Right.
And so Legos allow that as a medium. Of course, technically any building material from Play-Doh right on up. And if I can describe this to you, this little technique, it's actually a really good technique. But because autism has as one of its symptom diagnoses that deficit in social communication, they can't say to me, "Can I have that yellow block with the 3 things on top for this?" And so what do we do as therapists? We teach them to say that.
Right.
And so what I would do is I would give him the bricks, I would keep the instructions, or vice versa. And I would say, okay, step 1 is that yellow one and that black one go together. And he's hearing me and he's doing this. After a time of that exchange, then I hand him the book and I take the bricks and he tells me. Now, this is not all in one session. This is over 3
Right.
sessions, 4
Right.
sessions, 5 sessions, where the person with autism, is beginning to learn to do that social communication. Another great
Right.
example is in line with classic talk therapy. So imagine I have the 28-year-old adult male with autism sitting in front of me, and it is breaking eye contact, and it is stuttering, and the conversation is slow, and sometimes subjects are changed very rapidly, and that's okay. That is absolutely okay. But what I'm doing in that instance is I'm bringing him back and we're staying focused on this. I'm bringing him back and we're staying
Right.
focused on this because that social communication is easy for you and I. We've done it all of our lives. With him, there's that deficit in social
Right.
communication. So his English is fine, but it's how do I maintain eye contact, maintain, appropriate tone. I'm not yelling, I'm not whispering. How do I do that? And that's what we as
Right.
therapists are doing. We're
And
walking them through that.
how do I use the skills that I do have? Right. So I may not naturally
Yes.
understand the other
Yes.
person's body language. This actually is
Mm-hmm.
something I thought they did a pretty good job of in the Big Bang Theory with Sheldon,
Okay.
saying sometimes, okay, I'm clearly not picking up on the emotions, but based upon X, Y, and Z, I'm going to
Mm-hmm.
guess this is going on.
Yep.
And it's
Yep.
like I'm I don't think I'm neurodivergent, but I have some resonance with that because
Mm-hmm.
every test I've ever taken has shown my empathy is low.
Mm.
I do
Okay.
not feel other people's emotions, which is
Mm-hmm.
most basic empathy is you feel other people's. I don't.
Right.
Now, as a therapist, that has its pluses and minuses. The pluses is I don't get overwhelmed by my client's emotions.
Yes. Yes.
The minus is I got to figure out what people are feeling by thinking.
Mm-hmm.
I got to spend some time analyzing it. I just don't know
Right.
emotionally. So that sounds
Right.
exactly like, okay, how can you get to what you need to do to function?
Mm-hmm. Mm-hmm.
How are we
Oh my
gonna,
gosh. Yeah.
yeah, by using
Yeah.
the skills that you have
Right.
out here in the world? All right, yeah, okay.
Yeah. Well, how do they hold down a job? Because most autistic people that I see have a job. They the misnomer is, they're impaired and they can't. It's like, no, most autistic people I see have a job. It may not be the job that I dream of, but they have a job. And how do they interact with the public? Selling clothes, selling food. How do they do that? And part of it is modeled, like they're seeing how he does it, they're seeing how she does it, and part of it's reinforced. So the supervisor is encouraging this, and the supervisor is discouraging that.
Mm-hmm.
And us as therapists are going in there with the very behavioralist approach here and reinforcing what they've already heard.
Right.
For example, maybe he asks me, what did she mean when she said? Oh, well, that's a great question. That's a great question. What did she look like when she said that? Well, she was hunched over and her eyes were squinting. Oh, well, okay. That's important. And we're teaching, these basic facial expression, body posture, tone of voice. What does it mean when she smiles at me and nods but doesn't say anything? These are questions I get on the regular, which is it's cute as an adult who's married with kids, but for a young college age person who's neurodivergent and interested in dating, it is terrifying.
Right.
What does that mean? What does that mean? And so we're giving that appropriate feedback where it's like, when she does that again, do you want to, or would you like to, or do you think you should? And we're giving these people with autism options that they didn't realize they had to begin with.
Yeah, it's got to be challenging because, right.
Mm-hmm.
So, you talk about being I guess here I am a therapist, right? I am really good at figuring out what other people are feeling and thinking. Mm-hmm. A lot of us, even I though, still will have the sin of trying to put my way of thinking and my way of seeing the world in somebody else's head.
Mm-hmm. Mm-hmm. Okay.
I can't imagine if everybody else in the world is completely opaque. Mm-hmm. What it's like to try to understand what somebody else's point of view is.
Right.
When I can't, it's very hard for me to pick up on any of the normal social cues. Mm-hmm. I can see that be very challenging, and especially,
absolutely.
Right. The reality is, I think men have more leeway to be socially awkward in this world. Mm-hmm. To use the Big Bang Theory as an example, if the four mm-hmm. main characters were a bunch of women, that show wouldn't have been as successful.
No, it would not have. No, and you're right. Men, it is safer to hit a man emotionally, in this sense, comical. But obviously, Rain Man is a great example of the drama. Hit him dramatically or comically than a woman, and that's part of our culture. But it's also part of this understanding that was that kid in fourth grade, because everybody who's ever watched The Big Bang Theory looks at Sheldon and goes, that was that kid in sixth grade. And I remember him, and it was always male. And so it's relating
or it was me.
Relating to real life.
Yeah. Some of those people say it's, I mean, I don't identify with Sheldon, but I can have some identification with Leonard. I will be honest. Mm-hmm. Mm-hmm. I mean, there's the Harry Potter book right back there behind me. So
yeah, I see.
In 2010. So I can identify with that.
Part of therapy in general, whether it's with people who are neurodivergent or not, is that identification with the therapist. And Freud purposely tried to avoid this by sitting at the head of his patients while they laid down. But there is always the risk of we become, the projection being put on us and the client saying, you did. But the truth is, we should be a model. We should be a model for our clients in some way that's meaningful to them. Now, I'm not going to bring them home or take them out to dinner, but at the same time, they're going to look at our office, they're going to look at our demeanor, our presentation, and our words, and they're going to say, should I do that?
Right.
And maybe to themselves, maybe out loud, but they're going to say that, and we should be that model to them. Our reputation is as important as our knowledge when it comes to dealing with clients.
Absolutely agree with that. Yeah, absolutely. Yeah, I have some younger clients like, wait, you play Dungeons and Dragons? I'm like, well, here's what. Oh, yeah. Cool. So I guess my next question was going to be, what does improvement look like? It feels like we have hit on that already in terms of being able to learn how to read other people and learn how to accept themselves.
Yeah, there's no cure, right? There's no bibbity bobbity boo, and there's no pill that you just swallow one of these a day. Though certainly medication helps, supplements help. I'm a big fan of eating right, getting enough sleep, and exercise. I exercise probably not enough, but I do. But those three things are huge: diet, exercise, and sleep. So I'm a big fan of pushing all those. But instead of thinking of a solution like, okay, this is the final thing and we're done with it, it's definitely a growth progress process, just like it is for anyone else. They become a
Right.
more aware, just like I became more aware. Sometimes for me, it happens really quickly. I think about getting married and the first year being this huge learning curve of becoming aware of another person. I had a little brother. I thought I knew him well enough. Then I get married, and now I have a wife, and it's like I know nothing. So yeah,
Yeah.
that for them is true too, right? They leave high school, this highly structured environment, and now they're on their own. And it's like, what do I do? And a lot of people stay home. A lot of us people stay home, and they look to their parents for what they would have gotten from their teachers in previous years.
Right.
And the parents send them to us, and we're like, no, this is normal. Jobs are not easy, and usually the first one we take is not the one we stay with.
Right.
Matter of fact, the first major we take in college is not normally the one we
Well, it
stay with.
certainly wasn't for me. I started out as an engineering major and switched to
Mm.
psychology. So yeah, it's a big
Wow.
shift. Yeah. All my friends were engineers, though. Actually worked out pretty well for me because I had the best
Mhm.
social skills, of my peer
You
group.
did? You got all the girls? Is that what you're trying to say?
Well, I did marry my college girlfriend, and
Oh yeah, yeah, me too. Yes,
yeah, so
yes, absolutely.
it
So
worked
yeah,
out.
not being unrealistic about the outcomes of treatment for autism, because unrealistic outcomes are he's going to live on his own, get married, and have three kids, and maybe, but that's probably unrealistic if we're talking about a level 2 or level 3 person with autism.
Right.
Temper our expectations, and finally, what I express to the therapist needs to be very accurate. When I bring my autistic child to the therapist and say, I would like to work on, it needs to be specific. All goals should be specific and measurable. We think of SMART goals. But the autistic family, that should be paramount when they bring their
Right.
child to therapy. Instead of assuming that this therapist is going to talk my kid out of, no, that's not therapy. That's
Right.
not appropriate.
Right. Well, and I
Yeah.
think it's an argument that for having any child with any sort of significant illness, that
Hmm.
getting your own therapy
Oh
is
wow. Yes.
support
Yes.
is helpful. So,
Oh yes.
well, we're getting close to an hour here. So I think I'd like to just kind of close with asking what are some good sources of information on
Sure.
autism and for women specifically with autism. And I
Sure.
can put them
Sure.
all. If you can send me some links, I can even put them in the.
Right. No, that'd be awesome.
Yeah.
Yeah, we live in a marvelous age, right? I'm sure my grandparents said that after, World War II was finally over and America was doing better. But we live in a marvelous age. There's so much information available to us on the internet, whether it's something in writing, something audio like a podcast, of course, books. When we think about Amazon and other book dealers, there are so many good sources of information, but some of the best sources are always going to be professionals. So, we go online and we look up the person who specializes in autism, or we look up the books from those kind of authors. Those are really the best sources. There's a few good podcasts out there that I have gleaned a lot of good information from
Mhm.
that I really enjoy. And of course I'll share those with you. But one of the more advantageous ones, I guess is a nice way to say that, because all of them have been good. Is the neurodivergent couples therapy.
Okay.
That podcast has been really helpful because it puts adults with autism at the forefront. It's not so much talking about children with autism as it is adults. Which, to be quite frank, people with autism grow up, and so they'll be adults much longer than they were children. And
Right.
so that kind of information is super helpful. But yeah, I'll send you a few more over
That'll be
that you can put
great.
in the
I'll
description.
yeah, I'll put them in the
Um,
description, and
but
I will
yeah,
make sure I've
yeah,
got all your contact information in the
sure,
description because I may have somebody wants to follow up with you, and
absolutely,
I certainly
absolutely.
appreciate it. Will you coming on and talking
Oh
with me
yeah,
today? So
oh yeah. No, I've enjoyed it. It's always enjoyable to talk about things you love, and this is
um,
a great example of
yeah,
that.
awesome. Well, I can tell. That's why I like doing this because I like getting with people about things
Oh
that
yes,
they
oh
love.
yes.
So. All right. Well, thanks everybody for watching. And as usual, it's a YouTube channel, so I'm going to say, please like and subscribe. And we'll see you again next time. All right. Thank you.